Hello everyone. Today we are going to learn about cystoscopy in detail. Cystoscopy is also known as cystourethropy or prostatography. As this topic is new to you all, let's see a small video about this diagnostic procedure.
Your doctor has recommended that you have a cystoscopy. This procedure is used to examine your bladder for any abnormalities. Your doctor will insert a cystoscope, which is a thin tube with a camera and light on the end, through your urethra and into the bladder. This inside view allows your doctor to look for causes of bleeding or blockage, or any abnormalities of the bladder and its lining. This animation shows how cystoscopy is used to study your urinary tract. Typically, you are awake for cystoscopy. Your urethra will be numbed with an anaesthetic spray or jelly, and you may also be given a sedative to relax you. The cystoscope is inserted through your urethra and into the bladder. Your bladder is filled with a sterile solution, and you may feel the need to urinate. After the procedure, you are encouraged to do so. The doctor will examine your bladder for any abnormalities. Sometimes, the doctor might take a specimen of your tissue, which is called a biopsy, for further examination. Your doctor also examines your urethra. In men, the prostate is examined too. Once the cystoscopy is done, you are encouraged to urinate in the bathroom. Your doctor will usually discuss the results with you right away.
I hope through this video you all got some idea about cystoscopy. Now let's move on to the definition. Cystoscopy is an invasive diagnostic procedure that allows direct visualization of the bladder and urethra using a cystoscope inserted into the urethra. In simple words, it's a diagnostic procedure which allows you to directly visualize the bladder and urethra using a cystoscope. Purpose: to investigate causes of signs and symptoms. Second is to diagnose bladder diseases and conditions. Third, to treat bladder diseases and conditions. Fourth is to diagnose an enlarged prostate. Now let's see the indications. There are 4 indications for cystoscopy. First is hematuria, that means blood in urine. Next is recurrent infection, that means which occurs in large number or for a long period of time. Next is voiding dysfunction. That means your patient is unable to completely empty the bladder. Next is after reconstructive pelvic surgery. That means the constructive pelvic organ surgery. There are 2 types of cystoscopy: flexible cystoscopy and rigid cystoscopy. Let's see the difference between flexible cystoscopy and rigid cystoscopy. Flexible cystoscopy can bend easily, that examines the bladder and urethra. Rigid cystoscope cannot be bent and it is used to treat the conditions that affects the bladder and urethra. Flexible cystoscopy is not carried under anesthesia, so the patient stays awake. Rigid cystoscopy, general anesthesia is administered. Now let's see the contraindications. Contraindications to cystoscopy are relatively straightforward. If there is any evidence of acute urinary infection, the procedure would be contraindicated, as it could put the patient at risk for developing sepsis from a urinary source. As you can see, the equipments used are light head, camera, irrigation tube, bridge, sheath and lens. Flexible cystoscopy instrument is very flexible, whereas the rigid cystoscopy, the instrument is straight, which cannot be bent. Preparation of the patient: explain the procedure to the patient, explain how you are going to do the procedure and how painful or how the procedure will go through. Obtain informed consent, the signature of the patient. Withhold blood thinning medications, because due to blood in the urethra you might find any abnormal findings. So withhold the blood thinning medications such as aspirin. Also provide instruction for fasting and non-fasting preparation. Establish an IV line if anesthesia is needed. Then prepare the patient. Administer sedation and other medications as ordered. Instruct the patient to empty the bladder, place the patient in a lithotomy position, clean the genital area, and a sedative or local anesthesia is given. Now let's move on to the procedure. The procedure we have already seen through a video. First, cystoscope is inserted, urine is examined, and bladder is filled with irrigating solutions. Other procedures may be performed, such as if a prostatic tumor is found, a biopsy specimen may be obtained. Polyps can also be identified and excised. If any polyps are found, that can be removed. Ulcers or bleeding sites can be fulgurated using electrocautery. Fulgurated means it can be destroyed using a needle which is heated through electric. Renal calculi can be crushed and removed from the ureters and bladder. Renal calculi means kidney stone. It will be removed if it is found in the ureter by crushing it. Urethral catheters can be inserted via the scope to obtain urine samples from each kidney for comparative analysis and radiographic studies. Like if any studies we have to obtain any urine sample, urethral catheters are inserted. Then urethral and urethral strictures can also be dilated during this procedure. Strictures means restrictions of the urethral. Then cystoscope is removed, and specimen, if any specimen is there, it is sent to the laboratory. There are 3 complications of cystoscopy. First is infection. There might be any infection after the cystoscope is inserted. Next is bleeding. Bleeding means it might cause bleeding in the urine, that is called hematuria. Then pain because of the insertion of the cystoscope. Through this, we have come to an end of this diagnostic procedure. Thank you for listening. I hope you all understood.